Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw, Cebu. I'm Kriya Padilla-Doleda from CDN Digital together with the hospital at Maayo, and this is Maayong Adlaw, Doc. In the previous episodes of Maayong Adlaw, Doc, we talked about updates on COVID, chickenpox, and monkeypox. Today's episode, we will be talking about certain diseases that actually affect our lungs. But before we go there, let's watch this video first about the hospital at Maayo General Consultation Suites. The General Consultation Suites comprise of various internal medicine and pediatric specialties in the fields of infectious diseases, psychiatry, and pulmonology, among others. These services provide patients with personalized treatment plans and collaborative care from a team of competent and hospitable physicians. It is an integral part of the hospital at Maayo's multi-specialty practice, which is a one-stop shop for all their clients' healthcare needs. Here in one of Cebu's bustling cities, Mandaue, the hospital at Maayo is designed to give you the care and services you deserve. They prioritize your health, put your needs on top, and they make sure to give you a holistic medical experience. For today's episode, we will be talking about asthma and COPD, or chronic obstructive pulmonary disorder. Let's learn more about this topic from our guest doctor today. Our guest doctor for today is a first placer in the Philippine College of Chest Physicians Specialty Board this year, 2022. And he also placed 7th in the Philippine Specialty Board of Internal Medicine in 2019. He also landed top 7 in the 2010 Philippine Nursing Licensure Exam. On top of his accomplishments, he is a diplomate in adult pulmonology from the Philippine College of Chest Physicians and diplomate in internal medicine from the Philippine College of Physicians. Let us all welcome our guest for today, Dr. Chris Ray Arcelo Dumagin. Maayong Adlaw, Doc. Kumusta?
Maayong Adlaw, Ms. Kriya. Good morning to all our viewers for today, and thank you for having me.
Doc, we're going to talk about your specialization, which is kanang mga pulmonary diseases, no? And we will focus today on asthma and COPD. That's chronic obstructive pulmonary disease. Okay, first of all, what's asthma and what's COPD? What's the difference between the two?
Okay, when we say bronchial asthma, we have to be specific, no? Asthma has many forms, okay?
Alright.
So for the pulmonary standpoint, we are talking about bronchial asthma.
Okay.
Bronchial asthma is what's most commonly termed as hubak in the common parlance, no? Ihubak ko, But I just want to have this clarified. Now, when we say hubak, it's actually a very non-specific nga symptom. Okay, so most of the time, these patients, when they say gihubak sila, what they actually pertain to is naglisod sila og ginhawa, or nagsigi sila og ubo, gihutoy, no? But when you ask them further about their symptoms, sometimes dili gid siya bronchial asthma. Okay, so that's the reason why when you say hubak, medyo daghan kog pangutana nga mosunod, because we need to clarify kung unsa gipasabot sa hubak.
Okay, first, asthma. Kung plain lang di ay na asthma, what do we mean when we say just asthma, not bronchial asthma?
Because asthma can be of 3 forms, no? So it can involve the upper airways. That's what we term as allergic rhinitis. It's also a form of asthma.
Alright.
There's also skin asthma.
Okay.
No? So it's a hypersensitivity reaction sa skin. Okay? And kanina to ang storyahan karon is bronchial asthma. So it's a hyperreactive nga airways.
Wow, I have 3. All 3.
Yeah. So most of the time, manggod, because when we talk about asthma, it's actually a systemic disorder. So most of the time, ang immune system is hyperreactive. Okay, so yung tag-asthma, so it can be allergic rhinitis, it can be bronchial asthma, it can be skin asthma, or atopic dermatitis.
What we will talk about today is bronchial asthma to be specific. Sige, Doc.
So going back to the term hubak, no? So it's very, very common to hear this from patients nga. Lisod gani ginhawa, ilahang yung complaint is dok gihubak
Hubak
man ko.
dayon.
But when we talk about bronchial asthma, this is a very specific disease that involves the airways. No? So, ang ato ang baga, before air gets to the lungs, no, from the environment, muagin siya sa airways. So, these are just like tubes. Okay? So, kana nga tube, once the caliber of the tube decreases, then there will be airflow limitation.
Yes.
So, that's a characteristic finding in asthma. Mugamay ang caliber sa airways. So, di kaayo maayo mosulod ang hangin. Now, another important characteristic in bronchial asthma is that this airflow limitation is reversible. So, this will be in sharp contrast to what we see in COPD, in chronic obstructive pulmonary disease, because chronic obstructive pulmonary disease also entails airflow limitation, but the airflow limitation is irreversible. Okay, so ang asthma,
mas dangerous siya paminawon ang COPD.
well, they
Ano
are
ba?
equally dangerous.
Okay.
No, but ang COPD, from the term itself, chronic obstructive pulmonary disease, when tag chronic, it's long term. It's long term. The onset is insidious, and the duration is taas. No? So, ang asthma manggod, although it is a chronic form of a disease, but the symptoms and the airway limitation is reversible. Tukar-tukar lang. Usahay, mahuot ang agianan sa hangin, usahay wala pod. Depending on exposure sa triggers, sa allergens. No? So, muna siya ang main difference between asthma and COPD. But the underlying problem is somewhat similar. There is airflow limitation. So, that's the reason why both diseases, we term it as obstructive pulmonary disease, no, na ay airflow limitation.
So, ang COPD kay continuous siya, nga obstructed siya.
So, long term siya. So, in contrast po sa ilahang underlying mechanism sa cause, no, ang COPD, since it is chronic, no, it is irreversible. Actually, the cause of the obstruction there is permanent damage of the airways. And that is mostly brought about by the effects of smoking. So, manigarilyo ganita, there will be structural damage in the airways, and that would be the reason why there is permanent nga airflow limitation, non-reversible. Now, in bronchial asthma, the underlying reason why there is airflow limitation is there is airway inflammation. Kahubag ang gianan sa hangin.
Sige.
Okay, and the cause of the inflammation, as mentioned, is ang pagka-hyperreactive sa ato ang immune system. Okay.
So, it's like a natural thing ang sa asthma. You have it yun.
It's mostly
COPD kay
genetically predetermined. So, sometimes, or most of the time, kaning mga asthmatic doon nagkaliwat nga asthmatic sa pamilya. So, kani sila nga klase nga family members, no? Mo ni sila ang mga allergyhon, sigig sipon, sigig atsing-atsing. So, naay uban na sigig pangatol because again, these families are, we term atopic. So, hyperreactive, paspas sila mo react sa, ilahang immune system paspas mo react sa allergens in the environment.
So, other than kanang obstructed ang airways, what are the other symptoms of bronchial asthma?
In bronchial asthma, the symptoms are brought about by airflow limitation man. So, the most common symptom would be difficulty in breathing. So, sometimes these patients, mayngon sila murag kuwang ang hangin nga mosulod, no? Kutas ang paminaw. But one of the misconceptions is, pirmi maguta makadungog, dok, wa man ko naglisod og ginhawa, asthmatic ba di ko? No, but these patients actually, they complain of persistent nga coughing. No, so pwede kada lang ang symptom, bronchial asthma na siya. Sige, ubo. And ang ubo mostly mahitabo during matulog sa gabi, makamata sila, sige ubo.
Why man gabi usually, doc, or early morning, no?
Actually, the reason as to why it happens in the evening is not really clear. But mo lang ginay ato ang nakita na pattern, no? So mostly sa gabi, there would be nighttime awakenings, no? Or inigmata nila sa buntag, katol na ilang tuton lang, sige na og ubo.
Yes.
Or naiuban makamatag yun nga naglisod og ginhawa, murag nalumos ang paminaw. So these are just the typical symptoms of bronchial asthma.
Triggers ana, doc?
Mostly allergens gyud, no? So ang pinaka-common gyud nga trigger is pollen, dust, dust mites, no? Nasa tayo gitawag og asthma exacerbations, mga
What's
acute
that?
attacks, no? So ang asthma manggod, as I mentioned, long-term chronic siya nga condition, kunya reversible ang airway limitation. But sometimes there will be instances nga grabe ang symptoms. So those are what we term as asthma exacerbations, i-atake o hubak. And the most common trigger for that would be lung infections. So viral nga infection, pwede o COVID, pwede influenza, pwede pneumonia. So those are the most common triggers for asthma exacerbations.
Okay. So how do we diagnose? Kay you mentioned usahay nga na ay mga misconceptions bitaw.
Yeah.
So how do we diagnose na it's actually a bronchial asthma good? How do you know?
We actually have a test for that. It's called a pulmonary function test or a spirometry. So basically what it does is we ask the patient to blow through a turbine and we will be able to measure the amount of airflow. So if na ay airflow limitation such as in asthma or in COPD, makita na mo nga medyo mubo ang airflow nga ma-record. Okay? So in the spirometry also, diha na maka-measure me if the airflow limitation is reversible. Okay, so after the spirometry, we tell the patient to have a bronchodilator and then we measure the airflow again. If ang airflow limitation ma-reverse, then most likely the diagnosis would be asthma. So that's the most ideal diagnostic test.
Yeah, I've seen that.
Yeah. However, there are instances na the pulmonary function test is not available. We base our diagnosis on the symptoms of the patient as well as the family history. So if nagani kaliwat nga hubakon or kaliwat nga allergihon sa pamilya, and then the patient's symptoms are typical gyud of asthma, naagi reversible nga airway limitation, no? Usahay hungakon, usahay maulian ra iya, usahay sige ubo, usahay wala pod. So then we can make a diagnosis of asthma pod even without the spirometry.
I see. Where do we usually see kaning asthma? Who's at risk bitaw, Doc?
Actually,
Pinaka-common na at risk.
almost everyone would be at risk, no? As long as you have this genetic predisposition.
I see. Okay, so even babies,
Yes.
they can, be
So at any
asthmatic
age group,
right away.
asthma can be diagnosed. So from sugod sa pagkabata, naasad tay adult onset nga asthma. So what's important is if you have a genetic predisposition for this particular disease, then you are at risk.
Okay.
And at any stage sa imuhang kinabuhi.
But how come, Doc, na when somebody has asthma, it comes out, my entire family actually has asthma. My kids pa, they started, pag bata pa na sila baby hailer and all, but eventually, when they grew up, na-outgrow na po nila. And then,
Outgrow ang symptoms.
sa adult life ba, murag mawala man, and then towards the kaning pag nag-elderly na po
Balik na sad.
balik. How come it's
Because
like that?
the airflow limitation manggod, although this is not really proven, no, but we found out that usahay it comes in stages. So for example sa mga bata, sometimes ang symptoms magawas at 3 years old, and then they would have asthma symptoms until they become teenagers, and then at the age of 20 and above mawala ang symptoms.
Yes.
But there would be a tendency na balik ang symptoms inig adult nila, around 40 to 60. So it may occur in stages, although not all the time. As mentioned, this is a chronic disease. No? So the treatment for this one also, there's actually no cure for this, but we can just control the symptoms. So ingon ana na si mo na nga usahay mo ingon di mo kuhubakon sa una Dok pagkabata nganong karon pa man, no? And then when we do the spirometry, di gid ma-deny na agi reversible nga airflow limitation, then most probably ang iyahang asthma before wala lang ni manifest.
Has always been there, no? Yeah. So what are the different treatments available for that? Yes, it cannot be cured, pero I'm sure we can treat that para mahinay-hinay po ng symptoms.
So we can control actually. So when we start treatment for asthma, ang atuag yung goal is to control the symptoms and to prevent exacerbations. Okay? I just want to address a very common misconception na ang tambal sa asthma is ang kanang nebulizer, paso, no? So most of the time kani sila nga patients doc na among ko'y tambal sa asthma. So na nga tambal, ningon nila salbutamol for example, or nebulize sila with salbutamol.
Yes.
But salbutamol is actually a short-acting bronchodilator. So that is not a controller medication for asthma. It is just a reliever of the symptoms. So mayon ang patient maulian mo lagi ko salbutamol, of course, because the effect of salbutamol is to address the airflow limitation.
Temporary relief.
It only provides temporary relief. Maulian gyud, nindot gyud ang paminaw after. But the effects are short-term. So usually 4 to 6 hours mawala na na. And then naanasad kay symptoms, magpaaso na pug ka. Okay, so the treatment really for asthma is a controller. So gitawag na to na siya controller because it addresses the underlying cause of the airflow in limitation, which is the inflammation. Okay, so ang kaning ato ang ihatag na inhaler sa asthmatic patients, it actually contains corticosteroids. Okay, so it addresses the underlying inflammation. If you do not have that particular medication, then mawala lang imong symptoms because abre lang sa imuhang tambal ang imuhang airways, but the inflammation is still there. And if the inflammation is not addressed, magbalik-balik gid ang symptoms. So the treatment really is muna ang gitawag og inhaled corticosteroids. No? So muna siya ang controller treatment for asthma.
The steroids, no? So kaning mga
by the way, dili lang basta nga steroids, it has to be inhaled corticosteroids. No? So there are some
come
patients
in unsa ganin?
lain man gid og forma depende sa brand, no? There are some patients mangod who have been taking prednisone, oral steroids, no? So again, one of the misconceptions mangod of oral steroids is apil siya sa treatment sa asthma. Now, we usually give steroids, systemic steroids, not the inhaled steroids. We usually give them only during acute exacerbations. But for long-term control of the symptoms and the underlying inflammation, we use the inhaled form. Because it has lesser side effects and mas direct ang iyang action dito sa lungs. Di na siya moagi sa imong system.
I'm very familiar with that. Kaning uban inhaler, mga salbutamol, very common man gud atong makitaan mga tao, di ba? They carry that around. So that's just for temporary relief.
Importante sad na siya. It's also part of the treatment, no? But again, ang iyang use is for relief of symptoms again.
Okay. So not really to treat what's inside.
Not to control the as I've mentioned, our goal really for asthma is to control the symptoms as well as to prevent the exacerbations. So if we cannot address the inflammation, then balik ra gyud gihapon.
So what are the lifestyle changes na we can do to control
naidaghan, no? So aside from the medications that we can give, of course, an important part in the management is avoidance of triggers. And another misconception is kana bang magtuo ta nga if kanisa nga person asthmatic na siya allergy ani nga particular nga substance, tanan hubakon allergic sa dana. So actually kada individual na siya iyang kaugalingon nga triggers. So ang common lang gyud is ang dust, ang pollen, ang dust mites, ang kanang balhibo sa pets. Common lang gyud na sila nga triggers, but I have some patients nga ang trigger nila would be food, mangga, sahay.
So that can trigger asthma gadi ay no kanang allergies lang yun.
So one of the lifestyle modifications that we can do is to identify these triggers and i-avoid gid sila. Okay, even with the controller treatment, if the exposure to these triggers are consistent or constant, then di gihapon na to makontrol ang asthma.
There's a way, doc, no, to find out unsa imong mga allergens, right?
There's actually a test, pero I'm not really familiar how to do it. No? So,
pero right? Okay, sometimes we're not sure man good what triggers our allergies. So there is actually a way to know. So what kind of doctor do we approach for mga inaanak, doc?
Probably an allergologist yun. No? So they're the ones who are really trained to do such tests. So I think if ganahan kita mahibaw unsa gyud particular na to nga allergen gyud, then probably an allergologist can help. But actually, pwede raman og ikaw mismo ang maka-identify sa imong triggers, no? So for example, makabantay ka, abog ang palibot, trigger imong asthma, then most likely ang trigger nimo would be ang katong abog. So, ma-identify raman even without the specific test.
Okay, thank you, Doc. Now let's proceed to, for me, that's all the questions I have. Does anybody have additional questions? Okay, so let's proceed to COPD. You mentioned earlier na irreversible siya. No? So, unsa siya ka-dangerous? How do you get that? First, you mentioned katong smoking. What else?
Ang pinaka-common gid is smoking, no? But actually recently we found out also that even among non-smokers, pwede mo develop og COPD. So ang ilahang exposure is actually ang biomass. Biomass exposure meaning kanang aso sa ato ang nagdaog bataron, naghaling, no? So pwede na siya nga kanang cause of the irreversible damage sa ato ang airways. Another would be even if you are not a smoker, pero exposed ka to secondhand smoke, muhang kauban sa balay na nigarilyo, kauban sa trabahoan, tigpa nigarilyo, then you're also at risk for developing COPD.
Speaking of secondhand smoking, kanina itong mga vape, can that also, pwede na siya i-account as secondhand smoking?
That is actually quite controversial now, no? Because there are some who claim that ang kaning vaping is much safer compared to cigarette smoking. But for us pulmonologists in our society, we actually are against vaping yun, no? Because nagyapon na siya chemicals manggod. Although to a lesser extent compared to cigarette smoke, but there are some dangers also that is associated with vaping. So recently na natay mga vaping related nga mga acute lung injury. So not necessarily COPD gyud, no? So until such time nga makakita gid ta clear-cut evidence if vaping is safe or not. For us, kami mga pulmonologists, we are really against any type of smoking.
So that means na second-hand vape na smoking is also can also be dangerous.
It can be dangerous also.
Okay. So unsa pa other than kung obstructed, syempre we can't breathe well, right? Any other symptoms, Doc?
The symptoms would be similar with asthma po, no? So hangak, ubo, no? Cough nga dugay na. Usually more than 2 to 3 months nga ubo, di gid maulian na ay sputum production, na ay plema. So those are the common symptoms of COPD.
So mga kuan, puro external factors ang cause sa COPD?
Mostly exposure gid to noxious nga stimuli, because these stimuli are the ones who are responsible for the structural damage in the airways.
Which means na everybody can be at risk of COPD.
Anyone gid.
Okay. So when do we know na we actually have COPD na and that we really need to consult a doctor na pag grabe na gid atong ubo or unsa man?
I wouldn't advise nga wato na to mo grabe gid ang ubo, no? So any symptom nga inyuhang ma-feel, I would advise nga to seek consult immediately. As mentioned, manggod, every individual has his or her own kana bang outlook sa iyang symptoms. No? So naiuban nga sige nag-ubo but para nila normal naman ni. Dugay naman ni murag mo part na ginis ko. Na sa uban nga gamay lang nga ubo pa konsulta dayon. No, but actually my recommendation really is if naagyod kay gipamati nga symptoms, you consult a doctor immediately, because the earlier na to na siya ma-diagnose, mas sayon ang treatment. And mas mapungan na to. As mentioned, it is irreversible but it doesn't mean nga wala tayong mabuhat, no? So we can stop its progression actually. So the earlier na to ma-detect ang COPD, the better, because dili pa kaayo grabe ang damage sa airways. So pwede na to ma-stop ang progression of the limitation of airflow limitation.
Has it been more difficult to treat or manage COPD because of COVID?
COVID is one of the reasons nganong matrigger ang COPD exacerbation. No, although COVID dili maka-cause og COPD. So smoking gid na siya biomass gid, but because of the advent of the pandemic na ay COVID is one of the lung infections that can potentially trigger an exacerbation of COPD.
You mentioned earlier na we diagnose asthma using katong tool, no?
Katong spirometry.
How about COPD? How do we diagnose?
Maupod. So,
Maupod.
atong
Kung
spirometry
dili
gihapon.
siya
If there is no airway reversibility, airflow limitation,
pag after mo take sa medicine, pasabot, COPD
then most
na
likely
siya.
COPD na siya.
I see.
But of course, we also have to consider other factors, no? So mostly COPD patients, mga kanang elderly, mga adult na smokers man
Yes,
sila.
bitaw.
No? So kung younger individuals, di kaya ta magduda og COPD. But for individuals nga smokers,
Chances
elderly,
are
and then pag-abot sa spirometry na ay airflow limitation that is irreversible, chances are COPD siya.
COPD. How do we treat that, Doc?
The treatment for COPD, number one good is smoking cessation. So if smoker ka, as much as possible, as early as possible, undang na gid og smoke.
Nahala, stop na ko na
So undang na gyud. Second is, again, we take advantage of the inhalers. No? So ang inhalers for COPD, daghan sad na siya og klase. Now, unlike in asthma, nga naay steroids, na inhaled corticosteroids, in COPD, what we use are the long-acting bronchodilators. So, sometimes we use inhalers nga naay steroids depending on unsa nga klase nga patient, naa bay asthma nga component, or naa ba siya frequent exacerbations. So, we can make use of the inhaled corticosteroids. But for COPD lang gyud nga COPD per se, then we use the long-acting bronchodilators. Inhaler gihapon na siya.
Okay. In case, Doc, we won't be able to treat this right on time, no? What are the worst scenarios for COPD?
Since this is a chronic disease and the damage is irreversible, so if dili na to na siya ma-detect and di na to matambalan early, magkagrabe ang airflow limitation. So we have stages man in COPD depending on the degree of airflow limitation. So as it worsens, wala siya na-address, magkagamay gid ang agianan sa hangin. And these patients will become more symptomatic. Maskig maglingkod lang, hangak na. Mag-istorya lang, hangak na. Yung uban, magbatonis lang silang sinina, hangakon. No? So those are the severe forms of COPD.
Can we die because of COPD?
Matay gyud, no? So especially COPD.
Hindi na gid kaginhawa.
Hindi na gid kaginhawa. So mostly these patients are the ones nga wala gid makit-an og doktor. Or probably nakit-an but advanced stage na nga COPD, no? So as mentioned, the earlier manggod nato ma-detect, mas daghan patag options. Once we reach the most severe form of COPD, since it is irreversible, wala na kayo tayo treatment nga mahatag other than supportive treatment. So, probably the long-acting bronchodilators might help. Sometimes it doesn't anymore. Sometimes, kinahanglan na kita mag long-term na oxygen supplementation sa balay. No? And then, aside from that, mostly supportive care na lang yun. So muna, the earlier makaundang ta og smoking, stop smoking na gyud. The earlier ta nga makapakonsulta, if naatay gipamati nga ubo, bahala ginagmay lang, I would advise consult your doctor gyud immediately so that ma-treat, ma-diagnose, and ma-treat immediately ang gipamati na to nga symptoms.
Okay, so obviously, our lungs are very, very important na organ in our body. So, Doc, final question nako, how do we take very good care of our lungs?
Well, obviously, the lungs is an essential organ in our body, no? Because it is responsible for taking in air, no? So, diha moagi ang oxygen, and oxygen is needed by all the cells in our body. So probably the best advice that I could give is to always ensure that you are breathing in clean air. So, mao gihapon environment nga malimpyo ta sa to ang environment. Stop smoking if you are a smoker, undang na gyud tag smoking. And now that we are in the pandemic, we avoid good respiratory infections. Okay, so mao gihapon social distancing, wear your masks when needed because dili gid lalim nga makakuha ta og respiratory infection. So once the lungs are affected, medyo lisod gid na siya because the symptoms dili gid tiaw-tiaw, no? Lisod gid ta og ginhawa or ang ubo dili gid mawala. So that's probably the best advice that I can give. And then early nga consultation. So aron nga ma-diagnose early and ma-address na to early.
Doc Chris, this has been very informative and that was a great advice para sa viewers na to, no? Thank you very much for joining us in our show today. Would you like to say goodbye, final message to our viewers?
Thank you very much for listening. Thank you for inviting me and giving me this opportunity to raise our awareness towards asthma and COPD.
Oh, by the way, one last. Ako ba na ako? Kapinterving a question. One last. Do we have programs for kaning lungs bitaw? Awareness for taking care of our lungs, ani?
Yes,
What are the different
society, ang PCCP, no, the Philippine College of Chest Physicians, we have advocacy programs. So naatay smoking cessation programs, naasad tay lung month, naatay COPD, asthma month, no. So these are the some of the advocacy programs that we are trying to kanang reach out to all other individuals. So anyway, kita ra na ninyo social media naman taron, so you will be able to see kanang kung naana ni sila nga mga advocacies. But naata smoking cessation programs, as well as naatay TB month, again asthma month, naatay COPD month, lung cancer awareness month, nasa daan.
The pulmonary na association here in the Philippines is very active, considering na, we live in the Philippines. And it's great to know that you have a lot of programs and advocacies to help and reach out to other people. Again, Doc, thank you very much.
Thank you.
We hope to have you here in our show again.
Thank you very much.
And that has been for our 4th episode of Maayong Adlaw Doc Season 3. Thank you very much for joining us today. Please do share this episode to your relatives and friends so they may also learn from our discussions. And of course, from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience at the Hospital at Maayo. If you want to know more about them, please visit their Facebook page at the Hospital at Maayo, or their website at www.thehospitalatmaayo.com, or better yet, call these numbers below. This has been Priya Padilla Ruleda. See you again next time.